why is this important? Well, I could honestly be giving this talk in Sweden. I'm giving this talk at a symposium that's based in Canada. And I really believe that any one of these countries that's in blue can teach the United States something. So when I'm asking you and I'm giving and planting the seeds for you to use your knowledge as a physiotherapy consultant to improve maternal health internationally, well, I'm asking you to direct your efforts to the US. This is a chart of the maternal mortality ratio of high income countries. These are the 10 or 11 highest income countries in the world. And the United States has the highest maternal mortality rate out of all of them. Now, we know the statistics, this is not new, but my question that I will normally ask is how many weeks is 42 days? I'm going to see in the chat if any of you are with me still. Go ahead and put the answer. And sometimes it'll actually take that long. And this is one, I do this intentionally to see if my audience is still tracking with me. But then also just to see if we can do math, right? About 6 weeks, right? 6 weeks, give or take. And so when you start to now connect with your audience and you challenge their beliefs about, well, I'm an OBGYN, I see these patients at the 6 week postpartum visit. They get one postpartum visit after they give birth, and that's when we'll refer to physical therapy. I intentionally pause on this graph just a little bit longer so that they can read the subtitle. These are pregnancy and delivery related deaths up to 42 days. So these are individuals, these maternal mortality rates are actually focused on a group of people that don't make it to the 6 week visit. And so the reach that you have as a physiotherapy consultant, just think about that. If you know in the United States, we have the highest maternal mortality rate of any high income country. We are a very high income country. And we would pay you the way that I was paid to consult with a health system 3,000 miles from my home, then you would want to focus on this period. Actually, the talk is based on this period, 0 to 6 weeks, to capture these individuals who don't make it to their 6 week appointment and who would not make it to your outpatient pelvic health therapy visit. And so this is where I lose people. I think I've had more luck in my career actually speaking to a demographic that is either comprised of the national total rate of deaths or the non-Hispanic white race than I have in selling an audience who's mostly white on changing our practice to address the disparities for the Black and Hispanic population. I have to admit that as an outpatient pelvic health therapist, I've actually treated more patients of color when I moved my practice in the hospital than when I stayed an outpatient pelvic health therapist waiting for referrals and patients to come and find me. And so knowing that, I realized my work as a consultant would actually benefit everyone. Because if I could change a whole health system where it was standard of care to offer physiotherapy, occupational therapy after birth within 24 to 48 hours before that individual goes home and really has to meet the disparities of their recovery, I could actually affect everyone equally. If it were a Hispanic woman in the hospital, they would get a physiotherapy consult. If it were a Black woman in the hospital who's a single mom who has a third-story walk-up, she would get a physiotherapy consult. If it was a well-supported woman who had a single-level home, who had 3 months to 6 months of paid maternity leave, she would get a physiotherapy consult. I could guarantee that everyone, depending on wherever their lot in life was, equity, not equality, but equity, would get a physical therapy consult that would address their individual barriers. I could actually tailor now my intervention to someone who had a third story walk up or tailor my intervention to someone who had an unexpected cesarean section but was going to receive help. And so therefore I could focus my interventions on the caregiver in the room, on helping them protect their incision while they're lifting their baby or getting out of a bed that doesn't have hospital rails at home. And so maybe that visit would be shorter, or maybe it would be longer, depending on how involved the family was. I could never make that judgment. I could never make that judgment before I entered the room. And so I really, as a consultant, have almost this superpower that I want to infuse to you as my audience, that you could actually not worry about productivity working as a physiotherapy consultant. You only have to worry about humanity. I'm going to say that again. As a physiotherapy consultant, you don't have to worry about productivity. I promise you, I know that that's going to be probably a Q&A that I'm not going to have time for. But I do need to let you sit on that. The last thing I have done in my career is worry about a hospital system making money. In the United States, and there's an article I want you all to look up, it's by Bismarck Sakai, Sakai. And it was written, if I'm correct, 2021. And they did an assessment of the total profits around the United States, specifically after cesarean section. And the average profits from the smallest hospital in Mississippi, that's a very rural part of our country, rural state, if you will. There's cities that are larger, but for the most part, you can follow me. It's very different from New York, per se. And they did hospital systems across the United States in rural areas versus hospital systems in very affluent city metropolitan areas. And across the board, on average, hospitals profited about 15,000 USD. Now think about that, 15,000 in profits. That's after everything has been covered. That's after insurance has reimbursed. That's after the patient has gone home, the anesthesiologist has been paid, the OBGYN team has been taken care of. The hospital profits $15,000 on average after every cesarean section that's performed. Now it ranges from 4,000 to 26,000. But we're looking at profits. The average physiotherapy or physical therapy consult in the United States as an eval only, no treatment, is about $300 to $400. And this is why math is so important to me. And so when there's an argument of whether or not physical therapy is expensive, or whether or not we have the ability to provide these services, I think really we start to break down these arguments once we are informed and once we can educate our audience. And that's why I think as a physiotherapy consultant is probably the single best and single most effective way to affect change over a large population in a very short period of time, which is our lifetime. And so I paused the longest in this talk on this graph for this specific reason. You have a graph that's breaking down race, maternal mortality by race. And you have someone like me who's talking to you. And immediately I have to think like my audience thinks. If I am a non-Hispanic white person, how am I going to convince a health system to treat for its most vulnerable population? I'm not actually suggesting that you do that. I'm suggesting that you use a graph like this to educate the health system that the cesarean section is the most commonly performed surgery in the world. In the United States, non-Hispanic Black women are undergo the cesarean section more than any other race. And I believe that there is something we can do early after birth to improve their function and recovery. That's what you say. You say that on a graph that's as powerful as this. You never speak from an experience you don't have, but you do know that cesarean section recovery takes a lot longer than vaginal delivery when that person is sent home to figure it out on their own, or they have to wait 6 weeks to see someone versus someone after an elective knee or hip replacement who is seen by physiotherapy within 24 to 48 hours after surgery.